When you picture an orthopedic surgeon, what's the first thing that comes to mind? For a lot of us, it's this image of a master technician, right? Someone with incredible skill, fixing broken bones, replacing joints. The whole role is just defined by precision and what happens inside that operating room.
And you know what? For a long, long time, that picture was spot on. Orthopedic surgery was built on this super specialized expertise in the musculoskeletal system. The focus was always on the injury, the fracture, the one single part that needed to be repaired. But in the world we live in today, that very narrow focus, well, it's being seriously challenged. So, let's just think about this for a second. What happens when the patient with that broken hip is also trying to manage diabetes and heart disease? Or what about when systemic issues, things totally outside the hospital, stop a patient from even getting the surgery they need? All of a sudden, that surgeon's world gets a whole lot bigger than the four walls of the OR. So today, we're going to explore how the role of the orthopedic surgeon is being completely redefined. We'll look at the pressures that are really straining that old model, this big identity shift toward becoming a specialist generalist, the new skills they need, and what all of this really means for the surgeon of tomorrow.
Okay, first up, let's talk about the pressures that are forcing this change. The traditional, hyper-specialized model of surgery is basically facing a perfect storm of modern challenges that, frankly, it was never built to handle.
This number right here is a real game changer. A massive Scottish study found that a whopping 82% of patients over 85 have multiple chronic conditions all at once. It's something called multimorbidity, and it means a broken bone is never just a broken bone. It's tangled up in a whole web of other health challenges.
And these challenges aren't just medical. Just look at this table. This system itself has inequities that create huge barriers to care. Research shows that things like a patient's race or their income can actually determine whether or not they even get surgery. This tells us that access isn't just about medical need anymore. It's also about social justice.
And then you've got the pressures inside the hospital walls. Care has become so fragmented. This quote from a ward nurse in a Dutch hospital just says it all. You've got these strict hierarchies, these super fast rounds, and they can completely sideline crucial perspectives, like from the nurses, who often know the patient's whole story. And when communication breaks down, patient care can break down right along with it.
And get this, the pressure isn't just about patient health, it's about planetary health. The entire healthcare industry is a huge source of carbon emissions, 5% globally and a staggering 8.5% here in the US. The operating room is one of the biggest offenders, which adds a whole new layer of responsibility right onto the surgeon's shoulders.
So with all these pressures piling up, how are surgeons supposed to respond? Well, a new identity is starting to take shape to meet this challenge, the specialist generalist. And this isn't about giving up expertise. It's about making it broader and bigger.
The Royal Australasian College of Surgeons actually calls generalism a philosophy of care. It's about committing to a much broader perspective inside your specialty and really collaborating with the entire team to meet the actual needs of patients and the community. It's about seeing the whole forest, not just one single tree. And right here, you can see the difference laid out so clearly. The traditional specialist, they master one technical domain. But the specialist generalist manages the entire patient, understands all their complex health issues, and leads a whole interdisciplinary team. It's a huge shift from being a technician to becoming a true clinical leader.
So, what does this actually look like in the real world? Well, it means surgeons need a whole new toolkit of skills, and these are skills that go way beyond the scalpel.
The surgeon of tomorrow really has to be a leader in 3 new domains. They're now responsible for improving how their team collaborates, for helping manage the health of whole populations of patients, and for pushing for environmental sustainability in their own practice. These aren't just someone else's job anymore. They are now core responsibilities.
Okay, let's just take teamwork. Research on orthopedic teams points to some really concrete things surgeons can do. They can redesign daily rounds so they're less overwhelming. They can build empathy by having residents shadow nurses to see what their day is really like. They can create a low-hierarchy environment where everyone, and I mean everyone, feels safe to speak up. And, maybe most importantly, they can bring the patient in as a true, active member of the care team. And what about that environmental piece? Well, there are practical frameworks surgeons can start using right now. It can start with simple choices, like refusing to use unnecessary items, reducing waste wherever possible, and reusing equipment when it's safe to do so. These little changes can have a huge collective impact on the OR's carbon footprint.
So where is all of this heading? The surgeon of tomorrow is becoming a figure whose influence and responsibility stretch far, far beyond the sterile field of that operating room.
This quote from a recent article really just hits the nail on the head. The point isn't to turn surgeons into general physicians, not at all. It's about encouraging a completely different way of thinking, a way of looking beyond the bones to see the whole person, their complex health, and their place in the world.
And that leaves us with one last, really big question. Because the challenges facing orthopedics, complex patients, social inequity, environmental responsibility, they aren't unique. They are the defining challenges of all modern medicine. So as our world gets more complex, and our patients do too, maybe the real question is, isn't it time for every single specialist to become a little bit more of a generalist?